Now, we're doing urogenital next week, so if you see something like this, that's an ovary, you want to keep that. So try not to destroy anything that looks like an ovary or a uterus. In the males, actually, if you have a male cat, when you're working in this region here, just let me know, because there's going to be spermatocords and all sorts of goodies that are inside the male that we want to preserve for next week. Not sure if I should have that male one. Can everyone... I can go through this stuff twice, because that might be the best thing. So if you can't see, I guess you can start working on your cat right now, and I'll just go through this twice. Okay. And I'm just going to go through the blood vessels with you guys right now. Alright, for the heart, the ventricles are going to be more posterior. The atria is going to be more anterior, and then you have left versus right. So we may pin and ask you for the chamber of the heart, but most likely it'll show up on a model or an actual heart that you'll look at later on. But it shouldn't be bad to figure out if you need to. So from the heart, let's do arteries first. So from the heart, you have the arch of the aorta. But there is an arch right here, if you can see that. That's the aortic arch. And it's literally an arch like that. And you can see there are 3 arteries coming off of that. So the first is the brachiocephalic artery. And that's kind of hidden by this big vein here. But so right here. And there is no left and right brachiocephalic artery, it's just one. And that's going to be different from the vein. So you have a brachiocephalic artery, that's going to branch off into the right subclavian, so right here, and that goes into the arm. So it's subclavian right here. Once it gets past the rib, the first rib, into the armpit region, it's called the axillary artery. And at this point it would be the right axillary artery. Once it gets into the arm, and we'll pin it somewhere really obviously arm versus armpit, it's called the brachial, right brachial. Not branchial, brachial. Okay. And then also coming off of the brachiocephalic, you have the carotids. So you have the right and left common carotids, right here. And they're just kind of running along the trachea. At some point up here in the cheek area, it's going to split off into a bunch of different branches. At this point, we just want you to know external carotid. There's an internal carotid that goes deep, and a bunch of other things, but if we pin it up here, we're just looking for external carotid versus common carotid over here. Okay, and again, there's a left and a right for these. Okay. The other branch right here is going to be your left subclavian. Okay.
That one right there?
Yeah, so right here. So on your right, the right subclavian branches off of the brachiocephalic. On the left-hand side, it comes right off of the aortic arch. And again, it's the same. Once it gets past the first rib into the armpit, it's the left axillary, and then it's left brachial when it gets into the arm. If you follow the aortic arch, you have basically the dorsal aorta, which is just kind of running all the way down. But we divide that into thoracic and abdominal aorta. So the diaphragm, which is right here, is basically separating abdominal from thoracic. Okay. Try and do it. It's just a lot harder to see. Okay. So can you see thoracic, and then once it's past here, abdominal. Okay. So the first branch off of the abdominal aorta is the celiac, okay, just like the shark. So right here. And there's going to be 3 branches off of that. This cat has a really, really big stomach, so it's going to be kind of interesting. And you're going to have to kind of play around with the forceps in order to trace it. So if you pick away at a lot of this fat and connective tissue, you should see about 3 branches. So I'm going to grab this branch right here, and it's going to go Can you see that? Right there. So it's this branch right here. So if you follow that up, that is going to the liver. Okay, so that is the hepatic. Again, we would show you basically here because you can see it's going up to the liver, so you don't have to actually trace it on the exam. You're not going to have to flip-flop stuff. But just, we want you to trace it so that you actually see, like, hey, these are all connected. But this is hepatic. Now, off the hepatic, there's a little branch right here, and that's the gastroduodenal. That branches off, and that's kind of hard to see. You're going to have to play around a lot with this. It branches off and goes to the pancreas and the duodenum right here. And this is called the anterior pancreaticoduodenal because it's near the pancreas and the duodenum. Then there's another branch that goes to the greater curvature of the stomach. So here's the big stomach, greater curvature is going along here, and this is called the right gastroepiploic. So we're just following the right gastroepiploic. You're not concerned with the left gastroepiploic. So that's one of the branches from the cilia. The next branch right here, hold that, flip the stomach around. You'll see it goes to the lesser curvature of the stomach, so it's following here. And that is the left gastric. So on the lesser curvature of the stomach, you have the left gastric. On the greater curvature of the stomach, you have the right gastroepiploic. That's a lot of stuff. And then the last branch just goes to the spleen, and there might be a couple different branches, but basically it's going to the spleen, so it's splenic. Okay. So that's branches of the cilia. Now you have the cranial mesenteric artery that's coming off, and that's just going to the small intestines. Once it gets into here, these are the intestinal arteries that are just all along there.